Hello YouTube, and welcome to this new series I'm trying out called What the Hell Are They Thinking? Some episodes will be politically oriented and some will not. I have 2 episodes planned, for example, each for about the downfall of Nickelodeon and Cartoon Network respectively, which used to air some of the best shows on TV, but for whatever reason, with relatively few exceptions, air progressively crappier and crappier shows 24/7. With that said, let's get down to business. Obama, as I've noted in my anti-candidate video series, has promised us many things. One of which is to get the best cabinet people he can possibly find for his cabinet. That his nominees would share his stated values of competence and new ideas over cronyism and more of the same. With each nomination, it becomes more and more apparent that while the nominees do share Obama's so-called values, those values clearly are neither competence nor new ideas. Obama's most recent nominee, Kathleen Sebelius, for a start, for Health and Human Services Secretary, who's the same person depicted in the picture in this video, with the quote she made in 1989, I might add, when she is often praised for her supposed bipartisan credentials. And since her nomination, her work, particularly on health care in particular, has been touted by her supporters, but the praise simply does not match the facts. Any good she may have done, or tried to do as governor, is outweighed by her cynical and blatantly partisan attempts, as nearly every pro-abortion politician, including her boss should she receive this nomination, has done to define abortion as a health issue, while still falsely claiming that they are personally opposed to it. She does this, of course, like other pro-aborts, by defining it under the vague terms of family planning or women's health, which could mean virtually anything. Family planning could mean condoms, birth control pills, emergency contraception, and sex education. And women's health could mean mammograms to check for breast cancer, gynecological exams, or ultrasounds, all of which are what most people think of as family planning and women's health care, and none of which are particularly objectionable. But Kathleen Sebelius, who has consistently received a 100% perfect score from Planned Parenthood, Planned Murder should be their name if you ask me, who supports coercing taxpayers at gunpoint to pay for other people's abortions, is not most people. Like most direct national funding, most Kansas state funding is restricted by law, no thanks to individuals like Sebelius. So most state funding, like most national funding of abortion, is done indirectly by funding organizations that perform abortions or give advice on where to obtain them, like Planned Parenthood. Much of this funding is supposedly for the purpose of what most people, as I explained, would regard as women's health and family planning, but is still appropriated to organizations like Planned Parenthood, which, even if the funds are used directly for these cases, will still give aid and comfort to child killers by aiding their corrupt and all too lucrative industry, by freeing up more money for them to open up more clinics to murder more unborn babies. Any rational person knows these services could, of course, easily be provided without subsidizing infanticide, but, however, will women survive if we don't fund the morally bankrupt child killers who pretend to care about women while only being interested in the bottom line? Boy, however will we do that? Sebelius also uses the women's health argument against even the most reasonable restrictions on abortion. But her veto of House Bill number 2176, which if passed actually would have protected the health and safety of women obtaining abortions in the state of Kansas, is the most telling. According to sections 1C and D of the bill, it would have required that abortionists prescribe required equipment and supplies, including medications, required for the conduct in an appropriate fashion of any abortion procedure, that the medical staff of the clinic anticipate performing, and for monitoring the progress of each patient throughout the procedure and recovery period, require that the number or amount of equipment and supplies at the clinic is adequate at all times to assure sufficient quantities of clean and sterilized durable equipment, and supplies to meet the needs of each patient. Prescribe required equipment, supplies, and medications that shall be available and ready for immediate use in an emergency, and requirements for written protocols and procedures to be followed by staff in an emergency, such as the loss of electrical power. Prescribe required equipment and supplies for required laboratory tests, and require for protocols to calibrate and maintain laboratory equipment at the abortion clinic or operated by clinic staff. Require ultrasound equipment in those facilities that provide abortions after 12 weeks gestational age of the fetus. Require that all equipment is safe for the patient and the staff, meets applicable federal standards, and is checked annually to ensure safety and appropriate calibration. The Secretary shall adopt rules and regulations relating to the abortion clinic personnel. At a minimum, these rules and regulations shall require that the abortion clinic designate a medical director of the abortion clinic who is licensed to practice medicine and surgery in Kansas. Physicians performing the surgery in any abortion clinic are licensed, House Bill number 2176, page 2. To practice medicine and surgery in Kansas, demonstrate competence in the procedure involved, and are acceptable to the medical director of the abortion clinic. A physician with admitting privileges at an accredited hospital in this state is available. Another individual is present in the room during a pelvic examination or during the abortion procedure, and if the physician is male, the other individual shall be female. A registered nurse, nurse practitioner, licensed practical nurse, or physician assistant is present and remains at the clinic when abortions are performed to provide post-operative monitoring and care until each patient who has had an abortion that day is discharged." Unquote. Don't take my word for it. Check out the bill yourself. I have a link to the entire text of the bill in the description of this video. The bill was reintroduced in 2005, with Sebelius unfortunately vetoing it again. Her votes are, of course, not surprising considering her close relationship with the abortion industry, especially Kansas State abortionist Dr. quote-unquote George Tiller, who has made a name for himself nationwide by performing many late-term abortions, often with blatant disregard for state and federal law and the health and safety of his patients. More on that later, in part 2 of What the Hell Are They Thinking? Obama's Cabinet Picks. Until then, see ya.